On-the-scene coverage of ACC.13 is supported by Janssen Pharmaceuticals, Incorporated.
So the three studies are basically looking at the fundamental problem for cardiac surgeons. And that is, do you go on pump or do you not go on pump? In the old days, pump was considered to cause an inflammatory response, increase the risk of stroke, increase the risk of kidney disease. The three studies that we're seeing today, one in high-risk group, one concentrating just on elderly, and one in a large group, of which about a third were elderly, are basically discounting that. They're strongly suggesting that in the right hands, with the right patients, on and off pump are equivalent. They're equivalent not only at 30 days, which is the data that's out in the literature, they're now equivalent at 1 year. These studies are all properly powered, which was a weakness of some of the other studies. And each of them are complementing each other, and each are delivering the same message. That is, if you are well trained and you choose your patients correctly, which is the idea that SDS has put forward for many years through its registries, you will have the best outcome. I think this is going to change practice. Many people have been advocating that off-pump is the market leader. It's something that you should absolutely have. They've also been concentrating on off-pump in people who are younger, more fit, able to move along. This study, at least one study, suggests in the elderly you will have the equivalent response. Some people have suggested that on and off pump, for the high risk is a very variable question. This study suggests it isn't. You can do either as long as you're skillful. But the most important one is probably coronary, which has now shown that there's absolutely no significant difference at 1 year between on and off company in a cadre of surgeons who are considered experienced. If that's the case, then there is no strong argument to go off pump, and you can continue to go on pump, it will change practice if people adopt and agree with the studies.